Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, question analysis sessions, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Overall, with all of my review courses, I have maintained a 99% pass rate since 2015, and with my one on one sessions, a 100% pass rate. Now, my disclaimer and reminder is that we know there's no absolutes in medicine. You know that we treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. Before we get started with those questions, I did want to go over some housekeeping things and what is out right now. I have received some questions from you guys on how to access, so I wanted to put this on here and let you know that the links to everything will be in the description of this video. Now, upcoming November the 2nd from 10 a.m. to 11:30 a.m. Eastern Standard Time, we will have our practice question course. I did one back in July, and everybody really spoke highly of it, so I'm offering it for the end of the year if you're preparing for boards before the end of this year. Okay, so it is $89. I still try to keep it low for you guys, so that you can get in if you feel like you're struggling with some last minute things. I know that we we allot a good bit of things towards preparing for boards, but this you will get a number of things. During that hour and a half, I will break down both exams, the ANCC as well as AAMP, the current blueprint and what is on these exams, explain what that looks like for you. You'll understand the testing style, the question style, so that you know what to expect. We will work through practice questions live together for each system. I will tell you how to answer each question type. I will provide you with test taking tips, and you will also receive all of those questions as well as a worksheet on how to navigate through these practice questions. Okay, so there's only 10 spaces because I like to keep it small so that I'm able to truly give you feedback when we're working through these questions together live. Um, I'm really intentional about how I do it so that you can get the greatest impact. Okay, so grab your spot while they're available. I believe we have 8 spaces available. The antibiotic worksheets. Y'all asked about that too. The link is in the description. It is a worksheet. It breaks down by antibiotic system, gives you the common ones and the endings of them. It gives you common uses of it and contraindications. And I just put it in a chart format so that you can kind of just see it in an overview, because sometimes just kind of having it all in a sheet to kind of glance over and review daily can help with your studying and in practice. And then lastly, we've been covering diabetes all week. So I've also created a type 2 diabetes worksheet for you guys as well. Y'all know I love y'all. I've been really putting some things together to try to make it a bit easier for you. And with the diabetes worksheet, it just goes through the breakdown of what it is, our first line therapy, those the criteria to uh, confirm a diagnosis of type 2 diabetes, all the things, the medication groups, um, the contraindication of those, all of the things and its uses. So don't say I've never done anything for you guys. I'm hard. Look at me, can't even say it. I am working hard to help y'all be successful. So I hope you find it helpful. But again, these are linked in the description here and linked in the bio of the channel. I'll add it there. So practice question course, November the 2nd. If you want to join, it is $89. If you are not available for that day, let me know if you want to get it in a recording fashion. The antibiotic worksheet, $12.99. linked in the bio, as well as the description of this video. And then the diabetes worksheet is $14.99. All right, now let's get into our questions for today. Continuing our diabetes series. Question number 1. According to the American Diabetes Association, what is the medication treatment of choice for pregnant women? Is it A, metformin only? B, no treatment is warranted during pregnancy? C, oral diabetic medications are always contraindicated? Or D, insulin therapy is often the first line treatment? Take a moment and tell me what you got in the comments, you guys. All right, y'all know I always tell y'all to read the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. But here in this scenario, the stem is the question is the stem, right? So it says, according to the American Diabetes Association, the ADA, what is the medication of choice for pregnant women? And the best answer for this is D. Insulin therapy is often that first line therapy, and just simply because it does not cross the placenta. And then also, if you were unsure about this, y'all know I always say there's no absolutes in medicine. Y'all know when if you have my review book and things, in my test taking tips, I tell you to pay attention to absolute terms. Because again, what is my saying? There are no absolutes in medicine. So what does that mean? It's not always anything in medicine, right? It's not all of anything. It's not only, you know what I'm saying? It's not nothing is all inclusive in medicine. There's no absolutes. So metformin only should have made you kind of question that. No treatment is warranted during pregnancy. You know that's not true. Oral diabetic medications are always contraindicated. Contraindicated always? No, we don't. There's no absolutes in medicine. So if you ever see terms like that in there, you need to question that for test taking purposes. All right, question number 2. A patient who currently takes metformin for the management of her type 2 diabetes remains with uncontrolled glucose readings. When is a second line therapy warranted to better treat, is what that should say. Is it A, a patient with a history of hypoglycemia? B, A1C above goal after 3 months of lifestyle modification and treatment? C, an A1C less than 6.0%? Or D, an A1C less than 7.0%? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question here states, when is a second line therapy warranted to better treat? So the question is talking about a patient who currently takes metformin for the management of her type 2 diabetes, but her glucose remains uncontrolled. So when is a second line treatment warranted? Is it A, with a patient who has a history of hypoglycemia? No. If they have a history of hypoglycemia, we would be maneuvering a bit differently, right? We wouldn't be as affected or concerned about the uncontrolled glucose and type 2 diabetes. We would be approaching this differently. We wouldn't be trying to add additional stuff, right? B, an A1C above goal after 3 months of lifestyle modifications and treatment. Yes, this is your answer. If you have a patient and you have them on something, as metformin as example, and they're telling you their blood sugars are uncontrolled, you've been watching it, their A1C remains above that target goal, which is what? 7.0%, right? If it remains above that after 3 months of you initiating lifestyle modifications and treatment, after noticing that it's maintaining being uncontrolled and not being maintained, then you need to consider a second line therapy, okay? And then C and D, you could have ruled out. That says less than 6, less than 7, right? All right, and lastly, question number 3. The nurse practitioner and NP student are discussing insulin therapy for type 2 diabetics. Which of the following statements by the NP student shows adequate understanding of insulin therapy? Is it A, insulin therapy should be avoided in type 2 diabetes? B, insulin therapy is used to cure type 2 diabetes? C, insulin therapy may be warranted when patients are sick or under a great deal of stress? Or D, all diabetics eventually require insulin therapy? What do you think? Tell me what you got in the comments. Y'all been getting quiet in these comments lately. Tell me what you have so we can talk through it. And even if you're missing it when you're putting it here, that is another way of studying, because when you miss something and you gain feedback, it helps you to retain it. All right, so here, stem of the question. Which of the following statements by the nurse practitioner student shows adequate understanding of insulin therapy? That stem tells you specifically what we're looking for, right? So the nurse practitioner NP student are talking about type 2 diabetes and insulin therapy, and we're looking for a correct response, right? And here, C is your best answer. Insulin therapy may be warranted when patients are sick or under a great deal of stress. This is why we talk about glucose readings, and you may ask when you're doing your assessment if you notice a period of time where their glucose was a bit different, seeing if they were sick during this time or if they were under a great deal of stress, like having a loss of a loved one or things of that nature, or a lifestyle change in their career or work or something, various things that have a great impact on you. As we know, stress truly does impact your body, and illnesses put your body through a level of stress, and your body works to compensate differently, which can affect your glucose readings. And so sometimes during those periods of time, they warrant insulin therapy. So make sure you know that, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. All of the things that I do offer are linked in the bio of this channel. And again, the things and topics that I talked about with our upcoming courses, the practice question course on November the 2nd, remember that is in the description of this video. So just click up to the top of this video and you'll see the link to that. And then the worksheets will also be linked there, okay? All right, you guys. Happy studying. Bye, y'all.